Hello everyone, I am Malarvizhi.A, Assistant Professor from E.S College of Nursing. Today topic is pancreatitis. Introduction of pancreatitis. Pancreatitis is the inflammation of the pancreas which can either be acute, sudden and severe or chronic ongoing. The pancreas is a gland that secretes the both digestive enzymes and important hormones. Heavy alcohol consumption is one of the most common causes of chronic pancreatitis followed by a gallstone. Pancreatitis is one of the least common disease of digestive system. Treatment options include abstaining from alcohol, fasting until the inflammation subsides, medication and surgery. Next we will see the definition of pancreatitis. Pancreatitis is defined as infection and inflammation of the pancreas gland behind the stomach. They produce the digestive enzymes and hormones like insulin. It can be either acute, sudden and short term, or chronic, long lasting or potential damaging of a pancreas. Risk factors. There are two risk factors. One is the modifiable factors and another one is the non-modifiable factors. First we'll see the modifiable factors. Who are all taking long term of alcohol abuse, smoking, obesity, diabetes mellitus, family history, gallstone formation, medication and infection, high blood calcium level, elevated triglyceride levels. These are the modifiable risk factors. In non-modifiable risk factors like age, sex, race, family history, genetic predisposition, non-O blood group. Next we will see the causes. Long-term heavy drinking alcohols, any trauma or injury, infections like bacterial or viral infections or biliary tract infection, cigarette smoking, who are all long term of cigarette smoking, certain medication like who are all taking steroid medications, that also they will be causing of pancreatitis, pancreatic cancer, that is a malignance that is a cancerous that will be spread to the nearby the organ, and abdominal cancers. Types. There are two types of pancreatitis, acute pancreatitis and chronic pancreatitis. Acute pancreatitis is the inflammatory process of pancreas. The degree of inflammation varies from mild edema to severe hemorrhagic necrosis of the pancreas. In chronic pancreatitis is a continuous prolonged inflammatory and fibrosing process of pancreas, progressive destroyed and it is replaced with the fibrotic tissue, and strictures and calcification may also occur in the pancreas. Next we will see the pathophysiology. Due to the etiological causes, pancreatic duct become obstructed. This leads to hypersecretion of exocrine enzymes of the pancreas. The hyperenzymes of the pancreas, this leads to these enzymes enter the bile duct, whether they are activated and with the bile back up into the pancreatic duct. This leads to pancreatitis, that is the inflammation of a pancreas. Clinical manifestations in acute pancreatitis. What are the symptoms present like with the acute pancreatitis? Pain in the upper belly region, pain in the upper belly that radiated to the back, tenderness and touching the belly, fever, rapid pulse, upset of the stomach and vomiting. In chronic pancreatitis, what are the symptoms present like nausea and vomiting, weight loss, diarrhea and oily stool, difficulty digesting food, jaundice and back pain. In diagnostic evaluations, what are the investigations will take from the pancreatitis? First of all, they will be taking of a blood test like amylase and lipase that will be elevating of the level of the digestive enzyme that will be indicating of a pancreatitis. Complete blood counts, it helps to assess the immune system and metabolic panel it's including a blood urea nitrogen, creatinine, glucose and calcium level. And imaging studies taking of ultrasound uses sound waves to create the imaging of a pancreas and gallbladder, that is a normal functions or abnormal functions. They will be focusing on the ultrasound. And CT scan, it's creating the image of the pancreas, gallbladder and in bile duct. In MRI is used to magnetic resonance imaging studies to create the picture of the pancreas, gallbladder and then bile duct. And endoscopic ultrasound, taking of the ultrasounds, a small tube with a ultrasound device is inserted through the mouth and into the digestive system. ERCP and CPD stone identification and removal. Urgent ERCP is severe acute gallstone pancreatitis and signs of ongoing biliary obstruction and cholangitis. The treatments options of pancreatitis, the goal of treatments like aggressive supportive care, decrease the inflammation, limit the superinfection, identify and treat the complication of pancreatitis and treatment, conservative managements again IVSS, obtain sample, rapid electrolytes replacement, give analgesics, IM pethidine, give anti-emetic drugs to prevent the vomiting, and urinary catheterization is done, monitor the vital signs, injections ranitidine 50 mg IV, 8th hourly or omeprazole 40 mg IV BD they have to administer to the patient. And stomatostatins are octreotides, pancreatic secretion inhibitors and respiratory support, oxygen supplementation or venturi mask they will be providing to the patient. In pharmacological managements, morphine relief of pain, they will be reducing of the pain, they will be starting of a morphine, nitroglycerin or papaverine, relaxation of a smooth muscles and relief of the pain, antispasmodic or dicyclamine or propanthyline bromides, decreased of vagal stimulation, motility pancreatic outflow, carbonic anhydrase inhibitor, acetazolamide, reductions in volume and bicarbonate concentration of pancreatic secretion. Antacids is administered to the patient to neutralization of a gastric and hydrochloride, histamine H2 receptor antagonist ranitidine, proton pump inhibitor omeprazole, decreased in the HCl and stimulate the pancreatic secretion, calcium, hypocalcemia, tetany occur, prophylactic broad spectrum antibiotic, pancreatic enzyme replacement therapy they have to administer to the patient. And nutritional management, diet low in fat and high in protein and carbohydrate, take small frequent feeding of the patient in pancreatic enzyme supplementations with the meal, correct the malabsorption of a fat soluble vitamins like a ADEK and vitamin B12. In surgical managements, short procedure, it used to treat the damage to the body and tail of the pancreas, and Frey procedure, it used to treat the damage to the head of the pancreas, and pancreatectomy, it is a surgical procedure used to treat a severe chronic pancreatitis or cancer. And necrosectomy is a surgical procedure, a large open procedure to remove the diseased tissue. Laparoscopy transgastric approach is a procedure, a less invasive procedure to remove the diseased tissue. In nursing managements, provide oral or enteral nutrition with iron 24 hours of admission, provide a soft, low residue, low fat diet, encourage the choice of food to prevent the nausea, educate the patients on dietary restriction, educate the patient on lifestyle modification, particularly regarding alcohol consumption, monitoring the vital signs. Advice to the patients, provide oral or enteral nutrition within iron 24 hours of admission, provide soft or liquid diet or low residue low fat diets they will be advised to the patient. Encourage the patient to food to prevent the nausea. Educate the patients on dietary restriction and educate the patient on lifestyle modification, in particularly focus on the alcohol consumption and smoking or obesity, and monitoring of the vital signs. Thank you.